Hi everyone, welcome back to another edition of our Stats with Sara report. My name is Sara, epidemiologist here with the Jefferson County Health Department, and tonight we're going to be reviewing the data from week 33. The CDC week 33 consists of data from Sunday, August 9th to Saturday, August 15th. During week 33, we had a total of 320 confirmed and probable COVID-19 cases in Jefferson County. This brings our year-to-date total to 2,094. We remain at 28 COVID-19 associated deaths as of week 33. 15 outbreaks have now been reported in Jefferson County long-term care facilities. Outbreaks in those long-term care facilities are defined as one or more confirmed cases of COVID-19 in residents or staff. We did have 41 cases in those long-term care facilities throughout week 33. This means that 279 confirmed and probable cases were in the general community. Let's begin by looking at the table showing the number of confirmed and probable cases by week. On the left, you see the CDC week number, followed by the CDC week start date. Each CDC week begins on a Sunday and ends on a Saturday. So this past week covers data from August 9th to August 15th. This table includes our lab confirmed and probable cases. The lab confirmed cases include those individuals who receive a diagnostic test and are positive. Each individual is only counted once, no matter how many positive test results they may receive. So if they are tested multiple times, they're still only counted on our list and in this count as one. Individuals are reported as a probable case if there was a contact with a positive case, meaning that they were within that 6-foot distance for 15 minutes or more of that positive case, and they also became symptomatic. So essentially they meet the clinical and the epidemiologic evidence of having COVID-19, but they don't necessarily have a confirmed laboratory report lab evidence yet. We did see a decrease in cases in week 33 for the first time since the end of June. And while it was a small decrease, it is still encouraging. In figure 1, we see the confirmed and probable cases by week, this time in graph form. This visual shows how our weekly numbers are trending. You'll see that slight dip from week 33 right there at the end. The next chart shows a breakdown of the daily case numbers and the 7-day rolling average of cases. The dotted line is the number of daily new cases, which, as you can see, it fluctuates from day to day. We have been experiencing days where we receive reports of many new cases, especially when outbreaks from the long-term care facilities are reported to us. And then there's also days where we have a fairly low number of reports. That solid blue line, which is the 7-day average, helps to smooth out those fluctuations in the data. So as you can tell, it does give a better overall visual of the direction we are heading. Let's take a look at the age group data next. Once again, we will break down the school age group data into more detail later in today's video. All of our age groups experienced a somewhat equal increase in cases from last week, meaning that there wasn't one group in particular who had a much larger percent increase than others. The 20 to 29-year-olds are still showing the largest number of cases, and our 80-plus age group has the highest rate per 10,000. We use rates in many cases in order to make it easier to compare groups with differing populations. So in this instance, we can compare the rates among each age group with one another, but we also use rates to allow comparison among groups of differing areas. So say, for example, you wanted to compare the 20 to 29-year-olds in our county with the 20 to 29-year-olds in a neighboring county. As I mentioned earlier, we had no new COVID-19 fatalities that were reported to us during week 33. Our count remained at 28 as of August 15th, this past Saturday. Our fatality rate for Jefferson County is now 1.36, which is still below the rate for Missouri, 2.03, and still below the rate for the United States, which is 3.15%. In figure 7, we have the COVID-19 PCR test results by week. This data only includes those lab confirmed cases, so the number will look different from our main weekly case count because it does not include those probables. On this chart, if you look at week 27, you'll notice we have seen an increase ever since then in our percent positive. As of week 33, this past week, we did see a slight decrease in the number of positive diagnostic tests as well as our percent positive. Table 3 shows the positive and negative test numbers per week. Week 33, we had 287 lab confirmed positive cases. Our percent of positive tests this week is 10.6%. This is a decrease from last week, which is encouraging. I would like to make you all aware that this data is preliminary. So we often have labs that have reporting delays, and we also rely on the state to process and report those negative test numbers to us. There's often a 3 to 4 day delay when it comes to those negative test numbers. So it's not uncommon to see that percent positive change for a previous week or two until all the lab reports come back through to us. You might notice that sometimes the number of positive tests change also. So for example, last week during week 32, if you were to go back and look at our reports on Facebook, or if you were to watch our week 32 video, we reported 305 lab confirmed tests. You'll see on the table for this week, for week 32, there is now only 299 lab confirmed tests. So sometimes we are not made aware of certain demographic factors until the entire investigation process for a particular case is complete. So we may learn that that case may no longer live in our jurisdiction and that their lab could have had an outdated address on it. So we then remove that positive case from our count. There are other times when the probable cases receive a diagnostic test, and upon a positive result, they are now added to this PCR count. As you can tell, there are a couple different reasons why that percent positive may change for the previous week or two, so just be aware that the slight fluctuations are common as more reports come in and investigations are completed. Moving on to our race data, we take a look at Table 4, where the COVID-19 cases are divided up by race and rate by race per 10,000 residents is shown. The Black population in our community currently has the highest rate per 10,000, only by a small amount though. Our white population in the community has the highest number of cases with 1,674. As a reminder, we do not include any missing or unknown race data when we calculate these rates. Figure 9 shows our cumulative number of cases by zip code. Once again, the Arnold area 63010 shows the highest number of cases with 417. I'd like to point out a couple areas that had a high percent increase from week 32 to week 33, meaning that even though the total number may have not been the largest, the amount of cases that that particular zip code had from one week to the next increased significantly. These areas are 63019, which experienced a 41% increase in cases from week 32 to week 33. 63048 experienced a 59% increase, and 63050 experienced a 47% increase. Next, we look at the cases by zip code per 10,000 residents. In our last chart, Arnold seems to tower over the rest of the areas in terms of number of cases, but here, when population is taken into consideration, things are much more evened out. Arnold does have a rate of 117, and Imperial has a rate of 108, which are the two highest. However, there are quite a few other areas with rates close by in the 80s, 90s, and 100s as well. For our hospitalization data this week, we are once again going to take a look at the hospitalization data that we receive directly from our local hospital systems. We are currently receiving data from BJC and Mercy facilities and are actively working on receiving that data from SSM. As of week 33, a total of 129 COVID-associated hospitalizations have been reported from the hospital systems for Jefferson County. 23 of these patients were admitted to the ICU, and 8 positive COVID-19 cases required ventilators. In Figure 2, we see those hospitalizations by age group. Just as a reminder, this data consists of information from 2 out of the 3 main hospital systems around our area. So this data does not include information from SSM at this time. When we classify hospitalizations, we are including everything from an emergency room visit to those who are admitted as an inpatient and those ICU stays. Each one of our age groups has experienced at least one hospitalization, the highest number being in our 50 to 59-year-olds. Next, we will take a look at the length of hospital stay. We've had a cumulative total of 48 emergency room visits, which could be an indication that those individuals experienced symptoms that were severe enough to seek help. There are currently 16 Jefferson County patients who are still in the hospital at either a BJC or a Mercy facility. And we've actually seen the largest number of hospitalizations who stay about 1 to 2 weeks before being discharged. Moving on to our last report, we are going to review the school-aged population data in more detail once again. As of week 33, we have had 209 total lab-confirmed and probable cases in the 0 to 19-year age group for Jefferson County. Most of the cases from week 33 were in the middle school age and the high school age students. In Figure 1, this shows the number of confirmed and probable COVID-19 cases by week for the 0 to 19-year age group. Week 33, there were 36 total cases. The amount of weekly cases has been fairly steady for the past 4 weeks for this age group, and actually only 7 of those cases were in kids 10 and under. The rest were in our older kids aged 11 to 19. In Figure 2, we split up these cases by zip code. The highest number of cases are in children who reside in the Imperial area, 63052. And lastly, we will look at Figure 3, where we have split up the school-age cases into further subgroups according to the average age in each of the differing 4 grade levels. So pre-K, elementary school, middle school, and high school. This shows cumulative COVID-19 totals, so essentially totals since we began tracking back in March. Our high school age children, which is ages 14 to 19, hold the highest number of cases with 121. And in case you missed it, there was also a great special edition Facebook Live last night with our preparedness coordinator and our community services manager, where they discuss all things related to COVID-19 and the reopening of our schools. So the recording of that can be viewed right here on the Facebook page. That's all for our stats tonight. If you'd like to stay with us, I'll be doing some live questions pertaining to the data right after this video ends. Have a safe and healthy rest of your week, and thanks for tuning in.